Fasting in the month of Ramadan is a pillar of Islam and an obligation upon all Muslims who are physically able to do so. In this video, we are going to look at some of the physical benefits of fasting that are backed by science. Research has shown that inflammation can contribute towards the development of chronic conditions such as heart disease, cancer, and arthritis. Recent scientific studies have found that fasting can help reduce the levels of inflammation and promote much better health. A study was conducted using 50 healthy adults who fasted for an entire month. They noticed that the participants had significantly reduced levels of inflammatory markers. Another study discovered the same effects when the participants fasted 12 hours a day for an entire month. Today, heart disease is the leading cause of death, and it accounts for 31.5% of deaths worldwide. Fasting is the most effective way to reduce the risks of heart disease. A study was conducted in which 110 obese adults had to fast for 3 weeks under medical supervision. The researchers noticed significantly decreased blood pressure levels, as well as decreased levels of blood triglycerides and lower levels of cholesterol. In another study, 4,629 participants had lower risk of coronary artery disease, as well as a significantly lower risk of diabetes, which is a major risk factor for heart disease. A study using animals showed that fasting improved both brain function and brain structure. It also increased the generation of nerve cells to help enhance the cognitive function of the brain. Studies also show that fasting can increase levels of human growth hormone, HGH, an important protein hormone that plays a role in growth, metabolism, weight loss, and muscle strength. A small study was conducted with only 9 men who began fasting, and only after 2 days of fasting, they noticed a 5-fold increase in HGH production. Several studies have also found that fasting could potentially delay the effects of aging and increase a healthy lifespan. In one study, rats that fasted every day experienced a delayed rate of aging and lived 83%, lost a 5-fold increase in HGH production. Several studies have also found that fasting could potentially delay the effects of aging and increase a healthy lifespan. In one study, rats that fasted every day experienced a delayed rate of aging and lived 83% longer than the rats that didn't fast. Another study on rats showed how fasting helped to block tumor formation. Fasting was just as effective as chemotherapy without any side effects. Currently, the studies are only based on the formation of cancer in animals.